We now share our attention from politics and elections. The coordinator of Sharecare Ghana, a support group for people with autoimmune diseases, Nanaya Ajuman, has called on government to include the care of autoimmune diseases in the National Health Insurance Scheme. She said this will help reduce the cost involved in the management of the disease. Nanaya Ajuman made this appeal at the launch of Sharecare Ghana. Sharecare Ghana assists and encourages people suffering from autoimmune diseases. Autoimmune disease or disorder is a neurological disease that occurs when the body's immune system mistakenly attacks and destroys healthy body tissues. The exact cause of the disorder is not known, but hereditary factors are suspected to play a major role. There are many types of the disease, and Black Africans, especially women, are affected by the type known as multiple sclerosis. Multiple sclerosis affects any part of the body and most of the time renders patients paralyzed or blind or both. Symptoms of the disease include constant fatigue, rashes, loss of hair, recurrent miscarriages, and memory loss. After living a normal and healthy life for so many years, Nanaya Ajuman, a victim of multiple sclerosis, had to adjust herself to her new way of living, which was a state of total dependence after she was attacked by multiple sclerosis 12 years ago. According to her, life almost lost its meaning when she realized that she had to depend on a wheelchair to be able to move, a trauma that autoimmune victims live with. Nanaya said memories of the challenges and confusion her family went through during the early stages of her illness encouraged her to form the support group known as Sharecare Ghana to assist people with autoimmune conditions.
And we are seeking research, better diagnostics and treatment in this area of healthcare, which has been largely ignored in this country. For example, MRI scans are vital in monitoring many autoimmune conditions, and yet there's only one functioning, and only just recently functioning, in Ghana.
A neurologist at the Kolebu Teaching Hospital, Dr. Albert Akpalu, said although there is no cure for autoimmune diseases, when detected at an early stage, the disease can be managed. He called on more scientists to study neurology since there are only 4 neurosurgeons in the country where many people are suffering from autoimmune disorders. Director of the Ghana College of Physicians and Surgeons, Professor Paul Nyame, welcomed the appeal to involve the care of autoimmune diseases in the NHIS since it involves a lot of money to manage the disease. A deputy director at the Ministry of Health, Alhaji Limuna Miseni, said it is government policy to develop systems to reduce the burden suffered by those afflicted with the disorders. An endowment fund was launched by the association to enable people make contributions towards the works of the group.